One of the most common questions I get asked with patients that have scoliosis or know somebody has scoliosis is the question about exercise. And is exercise safe? Does scoliosis interfere with my ability to do exercise or sports? Should I be conscious of what types of exercises I'm doing? Can it lead to causing my scoliosis to progress or get worse? Should I be avoiding certain things because it can cause more pain or progression? There's all this confusion about, should I do this exercise to help my scoliosis get better? Like there's a concept of like general exercises can help improve scoliosis. So first of all, let's answer that question is, if you have scoliosis, can you still do sports, and can you still be an athlete at a high level? The answer is yes. In fact, many athletes actually have scoliosis, and they look at like somebody like Usain Bolt. He's like the fastest, human on the planet, and he has a lumbar scoliosis. So scoliosis doesn't necessarily mean it can limit your ability to become an athlete, but it can also be sometimes more challenging if the scoliosis has progressed to a certain level and you haven't managed the scoliosis. So a lot of these athletes that have scoliosis have used functional approaches to try to maintain their scoliosis from progressing and keeping it under control. However, there are specifically a belief that some sports and some exercises are definitely better than others when we deal with scoliosis as one of the conditions that the patient's having or the athlete having. Scoliosis patients should be a little bit cautious about doing sports that overuse one side of the body or are super high impact. However, what we find is there's always exceptions to those rules. There are patients that have scoliosis that still can do these things, and they have developed more like a functional adaptation within their body to deal with the scoliosis and to also be able to perform the sports. So in general, when we talk about sports and we talk about types of exercise, which ones are more appropriate when it comes to scoliosis? Now, sports that kind of work more evenly within the body tend to be agreed upon that they tend to be more ideal for scoliosis patients. But the truth is, there's very little data or very little research when it comes to this. In fact, when we think about what the causative natures of scoliosis being idiopathic in most cases, we don't know. So this is also true when it comes to sports or exercise and patients with scoliosis. One thing that I want to make very clear is that there's never a case that sports or general exercise will be considered a treatment for the actual cause of scoliosis or the progressive nature of scoliosis. There is no data that suggests that. In fact, most data is very inconclusive whether even sports or exercise or even activities in any manner could be associated with the development of scoliosis. So if it can't cause it, it probably can't correct it, right? That's one thing I would probably think about there. So one thing that used to be thought about was the idea of swimming. In fact, I remember hearing from patients that were diagnosed with scoliosis, 20, 30 years ago. Their doctor said, just go swim. If you swim, it'll actually fix scoliosis. Thinking of the ideal bend, like the bend that's going on, and it's the ideal exercise in their opinion because it wasn't compressive, because there's no gravity, you're floating in water, and so therefore swimming was considered to be the ideal exercise for every single case out there. In fact, there's still a lot of talk about that. Now, but is that true? The problem is when we deal with scoliosis, we have to understand there's two components we're dealing with. Yes, there is the S curvature or the curve that we're seeing from the front view, but what most patients are not realizing is that most scoliosis patients also have a problem with the side view of the spine. And the most common scenario with scoliosis patients is they get very flat in the mid-back. This flattening of the mid-back is also another component. In fact, a lot of cases when they get flat mid-backs, this can actually be one of the predictive factors for progression of a scoliosis case during adolescent cases. Swimming, depending on the style of swimming that you choose, can flatten the mid-back because they're extending to breathe so much. So even though swimming may be ideal for compressive natures, if it can accentuate the flattening of the mid-back, it can also not be ideal for that one scenario. In addition, that the swimming takes us out of our natural environment, meaning that our bodies are learning, our muscles are learning to deal with the compressive nature of gravity. So therefore, your muscles learning how to deal with compression due to gravity is one of the important things of dealing with stopping the progression of scoliosis. Well, if you're always in a pool and you're always swimming, your body's not gaining the strength while you're under load could also be one of the things that could not be ideal with swimming. But the good thing about swimming, it tends to be symmetrical. It tends to be non-compressive. So both those things are good, but there are some things that are not great. Running and walking is something I will talk about. Well, running is very compressive, but it is bilateral. It is under load with gravity, so you can learn that. But it has the compressive ideal associated with running. Walking, taking running down into a smaller level could also be an effective form of exercise for scoliosis, meaning something for them to do to gain fitness. But again, none of these things I'm talking about are going to be a curative nature or a therapy or a treatment for scoliosis. It's just a way for scoliosis patients to get exercise. Cycling is something that I talk about with scoliosis patients, that they can be in a cycle. Cycling can be done in lots of different positions. There's stationary bikes, and then there's actually bikes that actually move, like a normal traditional bike. And then they can be more like a upright bike with like a pedal forward system where you're kind of sitting more in an upright style. And then there's the bikes that are more traditionally built for speed where you're kind of leaning forward. Those bikes put different positions on the body, but the good news about both those bikes is they're both all non-compressive, which is good. But the bending forward bike can tend to flatten out the mid-back, where the upright bike can tend to flatten the lower back. So again, both those things can have their own unique scenarios when we're dealing with scoliosis. Rowing is another example that we can do for scoliosis patients that's non-compressive and that it's bilateral. And that tends to be good. However, bending forward can flatten that low back scenario, like I mentioned earlier, just like with cycling. So you can see, even though all these things like swimming, running, walking, cycling, and rowing, they tend to be bilateral. Some have a compressive, some don't have a compressive, some flatten the mid-back, some don't. They all have their own unique scenarios when it's associated with scoliosis. But the good things about all the things I just mentioned is at least they're bilaterally symmetrical. They're not working on one side versus the body versus the other. Now, what exercises should be kind of used with more caution when it comes to scoliosis cases? Sports that overuse one side of the body can be something that a scoliosis patient should be concerned about or use with caution. And these are things like tennis. Tennis is a very common example, or even pitching, or baseball pitching, softball pitching, because these things tend to use one side or one arm repetitively. In fact, these athletes sometimes develop actually a functional scoliosis as a result of their sport. You mean a small curve, and it's just happening from overdeveloping one side. Things like bowling could be also on that list as well, or any type of track and field thing that you're using, like a javelin throw or shot put. I think that you're doing one side of the body using one arm more regularly than the other. Also, the sports that twist around the spine in one direction, like golfing, could be something that could be concerned about as well, because it's overusing one side of the body more than the other. The other sports that should be used with caution are anything that's associated with high impact, meaning compressive force, like football and hockey tend to be very compressive. So we want to be concerned. Those can also have their own injuries, that can also have traumas that could help accelerate the progression of scoliosis. The most common sport that's associated with the incidence of scoliosis is going to be things like gymnastics, or things that do like gymnastic style moves like dance or cheerleading. It's these activities are very compressive, where you tend to see more incidence of scoliosis in patients that are gymnasts, that do dance, that do cheerleading. Now, it's unsure that if the sport is associated directly with the development of scoliosis, or is the fact that those sports tend to be more heavily populated by girls, that girls tend to do gymnasts and cheerleading and dance more often than boys. And we know scoliosis is definitely heavily weighted on females versus males. So it's unsure, but it's definitely something to consider. Now, when we look at all these sports, one thing I like to notice or mention is that all these sports can be used if a patient is compliant with their treatment. So most patients that are doing conservative treatment and they're doing conservative treatment to help manage and deal with their scoliosis, in most cases, if they're compliant, the treatment they're doing is outweighing anything that could be occurring in these activities, as long as they're compliant. Now, when it comes to exercises, and in terms of exercise being a treatment for scoliosis, there's one thing that we have to understand, that general exercise will never, ever be a replacement for treatment. We want patients to be active. We want patients to participate in sports. We want them doing things because in a patient-centered approach, meaning a functional approach, we're using their body to help correct their body. So we want that, but we should never substitute a sport for a therapy or a treatment. The most effective form of exercises are exercises that are designed for your specific scoliosis that match that curve type. We call these scoliosis-specific exercises. Scoliosis-specific exercises are designed to help reduce the curve specifically in a motion or a movement that's combined to help take in consideration all of the situations that are going on with your spine, not only the side view, but the front view, the rotations that are associated. And these exercises are designed not only to help stabilize the curve, but hopefully correct the scoliosis in a way that's going to improve your ability to perform all those other sports. So what we notice is that when patients actually contribute or participate in a process that's going to reduce their curve, their athletic ability actually improves because the better their spine is, the better they can perform all those other sports and activities. So that's our first goal. When we look at scoliosis, specific exercises, there's two main types. There's something I like to call segmental or regional, and then there's global. And most importantly, that we make sure that patients get both types of those. There's going to get those like the global self-corrective type of exercises that are going to deal with the entire position of the spine. And then we're going to get regional, that are going to deal with regions of the spine to help correct those specific regions with specific exercise. These exercises are normally customized and they're prescribed patient by a qualified physician that's going to be very specific to help deal with their scoliosis problems. One thing I want to mention here when we talk about scoliosis-specific exercises, one misconception is going to be some of these other exercises that I didn't mention, like yoga or Pilates, or those kinds of things. Even though I believe these are important for patients to get general fitness, these are, again, not replacements for therapy or treatment to reduce your scoliosis in a specific manner. To wrap up the entire topic on scoliosis and exercise, I think we can break it down relatively quickly. Most sports can be done with scoliosis patients, and it doesn't limit their ability to be an athlete or to perform at a high level when it comes to the athletic prowess of a patient, let's say. However, if you have scoliosis and you were looking at progression of scoliosis, there are certain things that we should be concerned about. Compression, one side of the body, are the things that we want to be concerned about. Exercise that work both muscles of the body and the spine is in a more neutral position are more ideal. Gymnastics, dance, and like cheerleading, things that have gymnastic style types of exercises can be the most associated with scoliosis, but not necessarily, if they're compliant with treatment, have to be completely avoided. And if you want exercises to deal with your scoliosis specifically, it needs to be a specific scoliosis exercise prescribed for your curve type, meaning somebody with another curve type may not benefit from the same exercise that you do. And that can only be prescribed by a doctor who understands your scoliosis, has evaluated you properly, and to make sure that you get the very, very best result by performing the exercise that's designed to actually reduce a curve. So I hope that makes sense. Hope that sums that up to you. I know there's a lot of information, but I hope that sums it up.